are live streaming. I'm still waiting. I'm going to try Robert again. So Nicole, can you unmute for a second?
Yeah.
So are you all set for the live stream?
I hope they are at the station. I'm here at home, so.
Okay. All right, perfect. And Robert, can you hear us yet? Okay. Okay, guys. Well, I think that we'll get started. Is everybody ready to go? Okay, so good morning and welcome to today's media briefing. As we continue to look for ways to practice physical distancing, we are taking this new approach today to our regular briefings. This will be our first briefing via Zoom. Should there be technical issues that occur, we ask that you just be patient with us. For our media partners, we will follow up with you individually if the call should drop and we're unable to get it back. And once again, we really want to thank all of you for sticking with us through this evolving situation and continuing to assist us in sharing this important information about COVID-19 with the community. We are definitely in this together. So we have a few speakers to bring you updates today. First up, we're going to hear from Acting Medical Officer of Health, Dr. Hsiu-Li Wang, who will open things up with an update about local cases and some changes and recommendations. So I will now turn it over to Hsiu-Li.
Hi, Julie. Thanks. It's just an update on cases, actually. So since we have surpassed 100 cases, we will be moving to aggregate reporting of cases on our website, which you've probably seen this morning at the 10:30 update. So in total, we now have 103 cases in Waterloo region. 60 of them are confirmed positive and 43 are what we call presumptive positive. So as a reminder, a presumptive positive is a case that is very likely to receive laboratory confirmation in subsequent days. Of that total, 19 are currently in hospital. The total number we have tested in the region is 1,740. Of that number, 1,158 have been confirmed negative. We are awaiting test results on 479 people, and we are monitoring in public health 582 people. And now 11 cases are resolved. This increase in numbers is not unexpected, and it is reflective of where we are now, which is in the steeper part of the curve. Everything we do as a community going forward to only go out when we need to and to maintain physical distancing when we are out will help us reduce the increase in the number of new cases in the coming weeks. I was happy to hear the province expanded their order to reduce the 50-person limit to gatherings to 5 persons, with some exceptions. This will further assist us in slowing the spread of the virus in our community. And finally, I know these last weeks have been difficult for our community. I want to thank individuals, families, businesses, and organizations for all that they're doing to help our community flatten the curve as soon as we can, often at personal sacrifice to themselves. These are very challenging times, and I thank you for your help.
Okay, thank you, Hsiu-Li. We'll now hear from Regional Chair Karen Redman with some advice around physical distancing.
Good morning. I would like to begin by reinforcing Dr. Wang's message about physical distancing. Many of us in Waterloo region are growing tired of being separated from others, and that's to be expected. We are all social creatures, and it's really hard to be separated from our friends, family, and loved ones. This is especially true as the weather gets warmer and as we get closer to Easter, Mother's Day, family birthdays, and other important dates. On a personal note, I too am finding it challenging to be apart from my children and grandchildren. This past Friday night, we scheduled an entire family gathering on Zoom. It ended up being really chaotic, kind of like real life, with the grandchildren popping in and out of the picture. It certainly wasn't the same as being together under one roof, but it was fun and it was a way to stay connected. We all need to remember that it's important now more than ever to maintain physical distance, and the rules from public health are that we work from home if we can, only go out for essentials like groceries and medication, keep 2 meters away from people outside your household, and reschedule gatherings like birthday parties, Easter meals, and barbecue with friends, or make those virtual gatherings. Remember, it's perfectly fine to go for a hike, to walk your dog, or get some sun on your porch. Just make sure to keep appropriate physical distance from others while you're out. I do want to clarify that the rules for people in self-isolation are a little bit different. If you're under a 14-day self-isolation because you've returned from travel or have COVID-19 symptoms, you should not be going outdoors. Don't walk your dog. Don't put yourself in a situation where you could come in contact with others. Once again, I want to thank everyone for being patient and doing their part. We know keeping people apart as much as possible is our single best tool to flatten the COVID-19 curve in Waterloo region. Please continue to stay home, stay informed, stay safe. We are in this together.
Thank you, Karen. Finally, we will hear from Region of Waterloo CAO Mike Murray, who will provide a brief update about resources that are available in the region for families. Mike?
Great. Well, thanks, and good morning, everybody. So this morning, I just want to provide a really brief update and overview about a couple of resources that are available for children and families who are, physical distancing. So there's a whole set of online resources available through the region's libraries. So you can go to the library website, www.rwlibrary.ca. You can sign up online for membership in the region's libraries. That gives you access to a whole network, a whole online library of resources. So we've got access to audiobooks, we've got access to podcasts, we've got access to all kinds of content through rwlibrary.ca. We've also, the libraries have also created a number of videos that are available for families and kids, quarantine crafts, Facebook Live presentations, storytime webinars, and we've got a live Twitter chat this afternoon. What do I read next? Ask a librarian. So all kinds of resources online through the libraries for families and children. The other set of online resources is through our museum websites. So Ken Sealing, Region of Waterloo Museum, Schneider House, and McDougall Cottage. So they've created a whole set of, they call it Museum at Home online activities. So those are available through Facebook, Twitter, and Instagram feeds for each of those three libraries. And you can also access that through all of the library websites, which is available through the region's website, regionofwaterloo.ca. So we hope that the library museum resources are helpful for families and kids who are spending a lot of time together at home.
Okay, thank you, Mike. I think now we're ready to go to questions, and I'm just going to go through our list of participants, and they've been organized for me in alphabetical order. So we'll start with Ben Apple at 570.
Hello.
Ben? Hi, Ben.
How are you?
Good.
Good. I have a question about the aggregate reporting. We're just kind of wondering why we're moving to that. Is it just because it's too resource intensive when you get above 100 people?
Yes, once you start to get above a certain number, like 100, what's more important are the overall trends. And yes, so we think that's what's important to keep our community informed about. And yes, that will definitely help in terms of, you know, less resources spent on individual details. It's also harder for the community to take the individual cases one by one and then see that bigger picture. So we're synthesizing that and providing that bigger picture up front.
Okay, now will your analysis then from your end be still including the age groups of people who are infected? Because I know part of the messaging has been trying to get it out to young people that they're not invincible. Wouldn't giving us more case details allow us to show people that message?
That information is on our website. I don't know if you had time to look at it yet. It has the breakdown by age group, so you could see what percentage of the cases are in what age group. Now, if we have people, less than 5 people in a specific age category, we will collapse them. So that's why you see, for example, under 20 or over 70, because the breakdown, if you break it further down, is less than 5. But as long as there's 5 cases or more, we will show the age category.
Okay. My
Sorry,
other
it looks
question.
like my video's gone off, so you can't see me, but I can see you.
That's okay. Hi, glad you can see me. The other question relates to actually our friends at the CBC with an investigation that's out today. They're saying that just over 42% of intensive care beds in Waterloo, Wellington are taken by patients either confirmed or suspected of having COVID-19. Is that true?
We are working with our hospitals to be able to provide a breakdown going forward of cases that are in ICU at any one time, of the hospitalized cases. Right now, you'd have to ask the hospitals about that specific, those specific numbers, because we don't have them, what was reported by the CBC. So I'd have to refer you to them.
Okay, so that's information just from the province. You don't have that?
No, our hospitals have that information. We are working with the hospitals to get that onto our reporting for the public going forward, but our local hospitals have their own information.
Okay, thank you.
Is that everything, Ben?
I did have another question, but I'll just stick to the 2 for now if you want. All right.
Okay, thank you. Okay, Catherine from the Record.
Hi, good morning, everyone. Dr. Wang, I wonder if you could just clarify a little bit about the significance of those numbers. By my math, that's a 49% jump from Friday when we had 69 cases. You say that's not unsurprising.
No, sorry, go ahead.
But I just wondered if you could elaborate a little bit about the significance. It seems like a big jump.
Yeah, if you take a look, it's about roughly doubling since last Wednesday. So that's sort of what's in line with what we're seeing in other areas that have a population like ours. And, you know, it's the other thing to remember, Catherine, is that we are reporting presumptive cases. And if you check on other people's websites, you may not see presumptive, you may only see confirmed. We made that decision locally because it can take us days, like 5 days or so, to get the confirmed result. So we don't want to wait until we get a confirmed result when we know that the vast majority of presumptives are going to be positive. And so that also explains why our numbers may seem a little bit higher than other places earlier, because we have those presumptives.
Yeah, I mean, but you had presumptives on Friday as well. So the jump of a 49% jump is apples to apples.
Yes, 3 days. Yes, after 3 days, there's been an increase, and this is in line with what I was expecting as an increase. And I'm hoping that over time we're going to be able to see a decrease in that rate. But right now, you know, this is what we expect once we are in that steep part of the curve.
Okay. I wonder if you could what about the fact of 19 people in hospital? That's a fairly significant jump as well.
Yeah, it seems to be also in line with what we see elsewhere, roughly speaking. We know, roughly there's a percentage around 20-25% that are going to be in hospital. And so if we take a look at the number of cases we have and the number in hospital, we're in that range.
Okay. I'm assuming you would be letting us know if there were any deaths?
Yes, absolutely. As sad as it will be, I expect we will have deaths. It's just right now we don't have any to report.
Okay, so do you just have an overall message? I mean, people may be somewhat alarmed by these numbers. So is there any message you want to send to the community when they see that we now have over 100 cases?
Yeah, it's more important now than ever to, to not go out unless you feel that you need to. And if you do go out, to practice physical distancing. And this will help our community. This will also help those that need to continue to go out to perform essential or critical work. And these measures are our most effective tool for slowing down the increase in cases in the coming weeks.
Okay, thank you. That's it for my questions.
Okay, thank you, Catherine. We'll move to Kate from CBC.
Awesome, thank you. My apologies, because I don't have a headset. My kids might yell or my dog might bark, so sorry.
We get it.
Yeah. For presumptive cases, when you look at the definition from the CDC, they talk about local testing. When we say very likely, is it based on symptoms or is there a local test being done? Yeah,
so those are tests are coming out of the Hamilton lab. And so, okay. So not all, well, I should say some labs are reporting presumptives like the Hamilton lab. So because many of our cases are being processed at the Hamilton lab, that's why we're getting a lot of presumptives. And really it's a lab term. It just means that this lab result is very likely to be positive, but they need it confirmed by a reference lab. Okay. For example, Public Health Ontario lab is a reference lab. So eventually over time, at some point, they'll probably not need that confirmation, but for now they still do. It's because of the increased lab capacity the province is bringing on. More and more labs are testing. And yeah, so that's why some are providing presumptive results.
Okay, so is it that someone, say, has the swabs done, that's initially sent to Hamilton, you get the initial result for presumptive, and then it, about 5 days walking towards me, and then it gets sent towards the other labs.
That's correct, a reference lab, and then it usually gets confirmed. Not 100%, but usually, but if it's not, so much the better, but the vast majority of the time it is. So.
Okay. Do we have a sense of how many of the positive cases or presumptive cases are healthcare workers?
We don't. We can provide that information going forward. What I can say is that we are prioritizing testing of those workers. So we expect that a significant proportion of them will be healthcare workers because we're looking for them. Just like a significant portion will be hospitalized people or people in congregate settings like long-term care homes. So we're going to expect more to see more and more cases in those settings and among those groups of workers. And we really want to, we do want to prioritize that because, as I had previously mentioned, that can change the approach that we have with these clients, but it also makes those facilities aware so that they can place the appropriate precaution as needed.
Awesome. And earlier this, or I guess over the weekend, Dr. Tam was saying that, we might start seeing sort of that flattening this week. Is that a possibility for the region as well?
Well, I'm hoping to see some evidence in the coming weeks, but I don't know if this can be this week. That's because I think she's taking a whole of country view, and there are some areas like BC that are farther in their curve than we are, right? So I think from a whole of country view, we may start to see some impacts, but here locally, we're still in that phase where we're rapidly increasing our number of cases. What I hope to see in the coming few weeks is a decrease in the curve here in our region.
Great, thank you. That's it from me.
Thanks, Kate. Okay, this being our first time doing a Zoom call, you can see that Dr. Wang's camera has glitched on us. So we've got someone over there who's just going to switch out so that you can see her again. So we're just going to switch.
All right.
Sorry, I realized, Julie, I had one more question. So I don't know where you want to put me in that, but I did have one more.
I'll circle back at the end, Catherine, and ask if there's any other questions. Does that work?
Julie needs to get you in.
Okay, so I still can't.
Oh, so I'm here again, but my name is now
There
Brian.
you go. We know who you are. Thanks, Hsiu-Li. Thanks, Brian. So we will now move on to Robert from Rogers. And Robert, I know you've had a little bit of trouble, so hopefully you can hear us now and we can hear you. Robert?
He is in the chat, mentioning stuff in the group chat.
Okay.
He says, our system limits voice and audio. I have the feed, but don't need to talk.
Okay, perfect. Thanks, Robert. Okay, let's move on to Nicole from CTV. Just waiting for you to unmute.
I think you're on mute, Nicole.
Okay, do you hear me?
There we go.
Mm-hmm.
Okay, so what measures are in place to protect residents of long-term care facilities and retirement homes as we see severe cases in other jurisdictions?
Mm-hmm.
And are there any current outbreaks in long-term care facilities in the region?
So there, currently we don't have any outbreaks, but I expect that, we will see clusters of cases, which is what outbreaks are, clusters of cases in residents, for example. Long-term care homes have received guidance from the ministry and continue to receive guidance on all of the measures that they need to put in place in order to protect their residents and staff. So for example, they've enacted very strict visitor restrictions. They are putting in place what we call infection prevention and control practices that are routine in terms of, the type of cleaning they do, the type of, personal protective equipment they put on if a resident has symptoms and things like that. So they're implementing guidance from the ministry for that. That said, we expect that there will be cases, and when there are cases and outbreaks, then the homes have additional measures that they will put in order to prevent further spread.
Okay. What is your practice or threshold for testing healthcare workers and first responders? Are all symptomatic workers being tested?
Yes. So, we will obviously triage based on severity of symptoms and whether they're seen at hospital or not. But in general, healthcare workers and those who are, having to perform critical services for whom testing will actually have an impact on how we manage them going forward. For example, when they're allowed to return to work, these will be tested whether they've traveled or not. These people, sorry, will be tested whether they traveled or not.
Okay. You know, of the 103 cases, 83 of them are between the ages of 20 to 59, which is not in line with the concerns that this primarily impacts elderly and the seniors. Are you surprised by these numbers?
Yeah, we're seeing this in Canada, that it's not, you know, it's affecting a lot of people in those age groups. You know, we do know that people that are older and that have other medical conditions, they're more vulnerable to, you know, having severe manifestations or complications from this illness. But we are seeing across Canada a lot of people in those age groups that you mentioned get the virus. And so I think it's just a message that everybody needs to be alert, and everyone needs to know that anyone could get it.
Okay, and my final question, you know, if 67% of the tests are coming back negative, sorry, I'm just gonna hang up this phone call. Hold on. If they're coming back negative, is it safe to say that 2/3 will come back negative? And are there concerns that these tests aren't being done right because the swabs apparently have to be shoved up the nasal area far?
Yeah, it's too early to say, you know, what the trends are in terms of percentage tested who will be negative. All we have is what you see now. The testing is very good. You know, could there be cases where the technique isn't perfect? Yes, that's possible. But by and large, the testing is very good. And so, you know, I don't have a reason to doubt that, you know, these are the confirmed cases or not. Yeah, overall, that's what I would say.
Okay, perfect. That's it for me.
Okay, thanks, Nicole. So I think that I have covered all of our news outlets. I know, Catherine, you had a follow-up question, and then I'll open it up to see if anyone else has missed a question, and then we'll wrap it up, okay? So Catherine, I need you to unmute.
Okay. So Dr. Wang, you had said that aggregating the data and the numbers of cases and the allow you to sort of better sift out overall trends. So I wondered if you could discuss what these overall trends that you're seeing are.
Well, one of them was mentioned earlier, that we are seeing a number of cases in groups that are, you know, younger than 70. You know, we've done a lot of testing in this region early on, and that's and we continue actually to do a lot of testing. In fact, we're doing more testing now among healthcare workers and people in homes like long-term care homes and hospitals. So, you know, this type of testing and is good. You know, even though we're having to prioritize groups that are more important for testing. I would just say that I think the overall thing that we're seeing here is that this is being spread. There's community spread across our community. That's one thing. And the second thing is, you know, anyone in any age group can get this, and so everyone needs to be careful.
Okay. So I'm going to try something. I'm going to unmute everyone just in case there's someone who has missed, but I'm asking you all to use good Zoom etiquette. And if you don't have another question, please mute your microphone. So here we go. Anyone else have a question?
I do.
Okay. Hi, Kate. Sorry, you were raising your hand and I was looking at the list. Go ahead.
I wasn't sure what to do. I felt like I was back in school. For The one question that I've also seen come out, Jacob, you have to wait. The one question I've seen is, when will we know when the majority of people in a community have had it or have been exposed to it? And without reporting and knowing and testing everybody, is that even a possibility to know, when more than 50% of the population has had it and maybe there's some herd immunity? Does that make sense?
Yeah, I get your question. No, it's a good question. I don't think we're gonna know that anytime soon, because that will probably require other means to detect. For example, usually when we have these types of new diseases, after a certain while, people will start to investigate other ways of like blood testing to see if somebody actually had an infection in the past. But this is not something that is happening right now, and so we won't have those indications until sometime in the future. It won't be in the immediate few weeks. No.
Okay. Any other questions? All right, well, that was our first Zoom media briefing, and I want to thank everyone again for participating and for your patience. I think we're going to get some good practice at this over the next little while, so we'll continue to refine, and really appreciate all of you sticking with us and helping us get these messages out in a timely way. So now that, and there's a new person joining. Now that we are wrapping up, you can go ahead and click End Meeting in your bottom corner of your screen.
Well done, Julie.
Thank you.
And
Thank
team.
you, Julie. Thank you.
Thanks a lot.
Yeah, thanks a lot.